In a case of lid retraction, one can see the sclera above the superior part of the sclerocorneal junction, which is a limbus. Normally we don't see, whereas in a case of lid retraction, we see. Okay, coming to ectropion. Ectropion is nothing but the rolling outward of the margin of the eyelid, the opposite of which is the entropion, which is a rolling inward of the eyelid. So this might also cause a condition called as trichiasis, where the eyelashes are directed inwardly. In such cases, a physician would have to do a repair. So we have specific codes like ectropion and entropion repair, and the method would be like thermocauterization. Via heat, the physician is going to cauterize, pass electric current and then destroy it. Next is like tarsal wedge. A wedge portion of the tarsus is just being removed in order to treat these conditions. Next is tarsal strip. What happened? The tarsus is made into a kind of a small strip or a tendon, and then it is made to help to attach to the orbit. So this is a method of treating this ectropion or entropion, where strips of tarsal fibers are being used. Next comes to conjunctiva.